Bismillahirrahmanirrahim. Now we will discuss the sphenoidal sinus, and location of the sphenoidal sinus is in the sphenoid bone, and it is right and left sphenoidal sinuses which are divided by the means of a bony septum. Both of the sinuses, like all other sinuses, are unequal in size and they will open into sphenoethmoidal recess. As I told you, in the lateral wall of the nose there were superior, middle and inferior nasal concha, and their meatuses that were superior, middle and inferior nasal meatuses, but this space above the superior nasal concha is known as the sphenoethmoidal recess. So sphenoidal sinus would open into the sphenoethmoidal recess. Now this sphenoid sinus, it is actually related in the superior side by the optic chiasma, that is the junction point of the two optic nerves, and hypophysis cerebri, that is the part of the pituitary gland. So optic chiasma and hypophysis cerebri. On the lateral side, the sphenoidal sinus is related to the cavernous sinus and the internal carotid artery. Arterial supply would be one from the internal carotid artery and other from the posterior ethmoid. Why it is posterior ethmoidal recess? Why it is from the posterior ethmoidal artery? Because you can see this is the posterior ethmoidal sinus, and one artery will be coming from this sinus to the sphenoidal sinus. So one is going to be the internal carotid artery, other is going to be posterior ethmoidal artery. Venous drainage, because the cavernous sinus is close to it, so sphenoidal sinus would go into the cavernous sinus. Secondly, it will go into pterygoid venous plexus. Thirdly, lymphatic drainage, it will be into retropharyngeal lymph node, and nerve supply, it will be from the, because it is related to the pterygopalatine fossa, so one will be into the pterygopalatine ganglion or the orbital branch of the pterygopalatine ganglion, and the other branch will be posterior ethmoidal nerve, because this sinus is closely related to posterior ethmoidal sinus. So arterial supply is also posterior ethmoidal artery, and nervous supply is also from the posterior ethmoidal nerve. And venous drainage, because of the closely related cavernous sinus is there. And we have discussed the location and everything related to the sphenoidal sinus.